we're going to see diffuse axonal injury. This is kind of a trauma to the brain. It's craniocephalic trauma or traumatic brain injury that occurs in devastating events, for example, deceleration and acceleration forces. Could be a automobilistic car accident or something like that, in which the patient is going towards this side by inertia. First law, Newton's first law is going, let's say, this, and suddenly it stops, and so the body continues going there. So, you know, this movement of the head, rapid deceleration, that produces this diffuse axonal injury. Now, this occurs because the shearing forces damage the axon. This is the axon of the neuron, so there will be a rupture of the axon, and so the axonal transport is inhibited. So there will be accumulation of the transporter proteins like alpha-synuclein or precursor amyloid protein. So we would see in a histopathological examination, we will see accumulation of these proteins on the brain, and there will be edema in the gray-white matter junction. And the shearing forces, because it's occurring on the axons, it's occurring on the white matter or white tract. So it will be on the corpus callosum, hippocampus, cerebral peduncles, and this usually is devastating. So the patient will have most of the times a coma or vegetative state. So the prognosis would be difficult to say. The treatment is just to diminish the edema that is provoking, like with head elevation or something like that. And remember that here the edema that is occurring at the great white junction is a cytotoxic edema, because it's not vasogenic. It's not that the blood vessels are disrupted or something like that. It's damage to the neuron, so they will not respond to steroids.